Good evening, my name is Keyshawn Goldmus and I represent Team 2, and this is our presentation on terminologies used in nursing practice. The topics we'll discuss today will be clinical care classifications, NANDA International, Omaha System, and the ABC codes. So the history of CCC came about from the home health care project conducted by Virginia Saba and colleagues in 1991 at Georgetown University School of Nursing. It was originally known as the Home Health Care Classification System. The purpose of the project was to develop a methodology for evaluating and classifying patients to determine what resources are required when providing home health services to the Medicare population. CCC consists of two interrelated taxonomies. The CCC of Nursing Diagnosis and Outcomes, which is equivalent to finding semantic type in SNOMED CT, and the CCC of Nursing Interventions and Actions, which is equivalent to procedures semantic type in SNOMED CT. So the purpose, functions, and governance. So let's talk about the current use and status. So the current use and status is to aid in documentation of care, to serve as a language for nursing and other health services, which include physical, occupational, and speech therapy, medical social worker, and home health aid. And it's because the data capture is enabled at the point of care. Examples of the systems, or examples of the uses of the systems include documentation of integrated care processes, classification and tracking of clinical care, development of evidence-based practice models, analysis of patient profiles and populations, predictions of care needs and resources. Now, the use of CCC also enables research and education, and supports the creation and use of electronic clinical pathways and protocols used in healthcare delivery information systems. CCC of Nursing Diagnosis and CCC of Nursing Intervention were both formally recognized by the ANA in 1991. So the ANA, they endorsed them as nurse taxonomies critical to nursing practice and supported and promoted their use in EHRs. They're both registered as HL7 languages and integrated into LOINC, SNOMED CT, and NLMs, UMLs, and the Meta Thesaurus. They're also indexed in CINA-HL. There's no specific schedule for updates, so content is revised as clinical requirements change in nursing documentation. Now, the structure and components. So they're both classified by care components, and provide a unique or a framework and unique coding structure. And basically that's for the purpose of mapping and linking the two taxonomies to each other and to other health-related classifications. Also for the purpose of assessing, documenting, and classifying patient care in hospitals, home health agencies, and ambulatory care clinics and other healthcare settings. The CCC taxonomies are also the basis for the ICNP developed by the International Council of Nurses and are referenced in the integration of a reference terminology model for nurses. They're approved by the ISO Technical Committee 215 Working Group 3 Concept Representation. They're approved by home health agencies as Medicare rules, coverage, and conditions of participation, and also linked in HCFA's forms 485 and 486 and the Home Health Prospective Payment Systems. They're available in the public domain, even though they're copyrighted, and also there's a requirement for use. Basically there's a written permission that's required. Thank you for your time.